stiffness, pain, swelling, and loss of flexibility. Osteoarthritis develops when cartilage breaks down faster than the body can repair it. I like to explain to patients that your cartilage is like the treads on your tire. When they get worn down, there's a friction that causes pain. While osteoarthritis is the most common in older adults, it isn't just a disease of aging. Osteoarthritis symptoms typically develop slowly and worsen over time. This is a progressive disease. Managing osteoarthritis is a long-term process. Lifestyle strategies can make a major difference. What is osteoarthritis? It's the most common form of arthritis, affecting millions of people worldwide. It occurs when the protective cartilage that cushions the ends of the bones wears down over time. Unlike inflammatory types of arthritis, like rheumatoid arthritis, OA is primarily a wear and tear condition, though inflammation can definitely play a role. Cartilage is the smooth surface that covers the ends of your bone in a joint. It acts like a shock absorber, allowing smooth, pain-free movements. When it deteriorates, bones begin to rub against each other. This leads to stiffness, pain, swelling, and loss of flexibility. Osteoarthritis most often affects the knees, hips, shoulders, hands, and the spine, but it can occur in any joint. I like to explain to patients that your cartilage is like the treads on your tire. When they get worn down, there's a friction that causes pain. While osteoarthritis is the most common in older adults, it isn't just a disease of aging. Joint injuries, repetitive stress, genetics, and lifestyle factors all influence risk. If you've had an old fracture near your wrist, knee, or ankle joint, you could develop arthritis down the road. Osteoarthritis symptoms typically develop slowly and worsen over time. This is a progressive disease. Common signs include joint pain during or after movement, stiffness that is worse in the morning or after inactivity, swelling and tenderness around the joint, loss of flexibility or limited range of motion, and grinding or clicking sensation when moving the joint. Symptoms often flare after increased activity and may ease with rest, although long periods of inactivity can also cause stiffness. Osteoarthritis develops when cartilage breaks down faster than the body can repair it. Over time, this imbalance causes structural changes in the joint, including thickened bone, narrowed joint space, and inflammation of the surrounding tissues. Risk factors include age, so your risk increases with age. Gender. Surprise, surprise, but women are more likely to develop osteoarthritis after the age of 50 in those perimenopausal and menopausal years when the estrogen drops. Obesity, extra weight increases stress on weight-bearing joints, and joint injuries from sports, accidents, or even repetitive strain. Repetitive use, like your occupation or activities that overwork certain joints, can cause osteoarthritis. Genetics cannot cause osteoarthritis. Family history can definitely increase susceptibility. And bone deformities, misaligned joints, or congenital issues that start to rear their ugly head when you get older. A healthcare provider will usually diagnose osteoarthritis using medical history and physical exam, discussing symptoms, activity levels, and joint function. The most common imaging is X-rays, which can show narrow joint space, bone spurs, and other changes. MRI can sometimes be used for earlier or more complex cases. Lab tests like blood work or joint fluid analysis can help rule out other types of arthritis, such as rheumatoid arthritis or gout. So how does osteoarthritis differ from other forms of arthritis? The term arthritis simply means joint inflammation, but not all of them are the same. Osteoarthritis is a mechanical and degenerative problem. Cartilage wears down, bones rub together, and stiffness develops gradually. It's usually affecting one or few specific joints, especially those that bear weight or experience repeated stress. Rheumatoid arthritis is an autoimmune condition. The immune system mistakenly attacks the lining of the joints, causing widespread inflammation, swelling, and damage. Rheumatoid arthritis is an autoimmune condition. The immune system mistakenly attacks the lining of the joints, causing widespread inflammation, swelling, and damage. RA often affects both sides of the body symmetrically, for example, both wrists or both knees, and may involve fatigue or systemic symptoms. Gout is caused by uric acid crystals depositing in the joints. It often leads to sudden, severe attacks of pain, swelling, and redness, most commonly in the big toe, but sometimes in other joints. Psoriatic arthritis occurs in people with psoriasis and can affect both small and large joints, sometimes mimicking RA, but with different patterns. Understanding the difference matters because treatments vary between all of these conditions. Anti-inflammatory and disease-modifying drugs are critical for conditions like RA or psoriatic arthritis, while OA management focuses more on lifestyle changes, physical therapy, pain control, and in advanced cases, surgical options like a total knee replacement. There is no cure for osteoarthritis, unfortunately, but treatment can relieve symptoms, improve function, and sometimes slow down the progression. The options include conservative treatments. This includes exercise and physical therapy, strengthening muscles around the joint, improving flexibility, and reducing stiffness. Weight management is also extremely important because this reduces stress on your weight-bearing joints. Some medications can be helpful. Over-the-counter pain relievers such as acetaminophen and NSAIDs can be used temporarily. Topical creams like Voltaren gel or patches for localized relief, and even sometimes narcotic medication. Braces or orthotic-assisted devices can support affected joints and help with mobility. There are various injections we can use. Probably the first you'll hear about is corticosteroid injections. This will reduce pain and inflammation for weeks to months. Hyaluronic acid injections provide lubrication and cushioning for knees in some patients and can last lots of months. Platelet-rich plasma or regenerative therapies are emerging options that may reduce inflammation and support healing in the most natural way. There are some surgical options available for arthritis. During arthroscopy, which is a minimally invasive procedure, we can perform what's called a chondroplasty. This is a shaving of the bone. You can also undergo a bigger operation called osteotomy, which realigns the bones and decreases joint pressure. Joint replacement for hip, knee, or shoulder is for severe osteoarthritis when treatments have failed. Managing osteoarthritis is a long-term process. Lifestyle strategies can make a major difference. These include staying active with low-impact exercises like walking, swimming, or cycling, maintaining a healthy weight, using heat or cold therapy for symptom relief, practicing joint protection techniques, avoiding repetitive strain, and using proper posture and techniques. Osteoarthritis is a chronic condition, but it doesn't have to mean giving up mobility or independence. With the right combination of treatments and lifestyle changes, most people can manage pain effectively and maintain an active lifestyle. Early recognition and intervention is key when it comes to osteoarthritis. Addressing symptoms early can slow progression, preserve your joint function, and improve long-term quality of life. Thank you for tuning in to The Resilience Factor. If you're ready to build a stronger, longer-lasting body, make sure to subscribe and share this episode with someone who's ready to thrive. You can follow me at Dr. Pamela Mehta for more expert tips on strength, recovery, and orthopedic health. Until next time, stay strong, stay smart, and stay resilient.